AED mode in the LIFEPAK 35 monitor defibrillator provides a prompted treatment protocol and ECG analysis using our patented shock advisory system. Your LIFEPAK 35 may be configured with CPR Insight available in AED mode, and your device can also be set up to display the top 2 waveforms in AED mode or no waveforms displayed. If no waveforms are displayed, the messages and prompts fill the page. CPR Insight enables the LIFEPAK 35 to analyze the patient's heart rhythm during ongoing chest compressions. This can reduce pauses in chest compressions and help maintain circulation of the blood. AED mode still requires interaction in order to defibrillate the patient. The LIFEPAK 35 offers AED mode settings for 2 patient types, adult and pediatric. The adult setting is for patients weighing more than 25 kilograms, 55 pounds, or who are more than 8 years old. The pediatric setting is for patients weighing less than 25 kilograms, 55 pounds, or who are less than 8 years old. When selecting a patient type, this not only affects the defibrillation energies used, but also the available compression to ventilation ratios of the metronome. AED mode may be automatically activated upon powering on your device, or you may need to activate it by pressing the Analyze button. Before initiating AED mode, first verify that the patient is in cardiopulmonary arrest. If the therapy cable is not already connected, connect it at the top of the device. You can then power the device on. Connect the therapy electrode pads to the therapy cable. You should prepare the patient's skin for therapy electrode pad placement. Apply the therapy electrode pads to the patient's chest in the anterior lateral position. If the defibrillator starts in manual mode, push the Analyze button and the patient type pop-up will appear. If the monitor defibrillator starts in AED mode, push Analyze prompts will begin and a pop-up will appear to select patient type. To initiate the analysis, push the Analyze button. Take care not to move the monitor defibrillator or patient during analysis. Follow the directions provided by the monitor defibrillator. After analysis, the device will provide one of 2 prompts. Shock advised or no shock advised message will occur. If the AED detects a non-shockable rhythm, a no shock advised message will occur. If a no shock advised message occurs, the defibrillator does not charge and no shock can be delivered. This message will be followed by the Start CPR prompt. If the AED detects a shockable rhythm, the shock advised charging prompt will occur. Once the charging is complete, the available energy will be displayed. The Stand Clear Push Shock prompt will occur along with the Shock Ready tone and the shock button will flash. Before pushing the shock button, ensure everyone is cleared away from the patient, bed, cot, or any equipment that is connected to the patient. Once everyone is cleared from the patient, you can push the shock button to deliver energy to the patient. Start CPR prompts occurs, indicating that the energy transfer was completed and you should start CPR. The Start CPR prompt, countdown timer, CPR metronome, and ventilation prompts will continue for the duration specified in the CPR time, which may vary based on your site-specific policies and protocols. To mute and unmute the CPR metronome and ventilation prompts, press the speaker icon. It should be noted that does not silence alarms. The shock counter indicates how many shocks have been delivered to the patient. Depending on device configuration, some devices may be set up to automatically escalate energy after a shock is delivered. Users can always check their next available energy at the top of the screen. There are 2 ways you can switch from AED mode into manual mode. You can press the Manual Defib button in the bottom right corner of the screen. Or to begin charging as soon as manual mode is active, push the Charge button on the front of the device. You can always switch back into AED mode by pressing the Analyze button on the front of the device, or by pressing the Resume AED button at the bottom of the screen. Your LIFEPAK 35 may be configured with CPR Insight. When CPR Insight is enabled, the first analysis after entering AED mode is performed using the traditional shock advisory system. During SAS analysis, care providers must stand clear of the patient. Subsequent analyses are performed using CPR Insight during the last part of the CPR time. If the defibrillator detects a shockable rhythm using CPR Insight, the device will automatically pre-charge the device before the end of CPR time. This enables the shock to be ready to be delivered as soon as CPR ends. If the defibrillator detects a non-shockable rhythm using CPR Insight, the No Shock Advised message will be provided before continuing into the next cycle of CPR time. If the CPR Insight analysis is inconclusive, you will be instructed to stop compressions, push the Analyze button at the end of the CPR time, and stand clear for analysis. Thank you for watching the LIFEPAK 35 AED mode video.